Autism, where affect is the #1 tool we use in supporting child development through playful interactions.
Hello, and this week we have with us a returning guest. Speech and language pathologist Amanda Binns in Toronto is back with us to talk about another new publication. A few weeks back, we did a podcast about the recent publication on self-regulation in speech and language pathology and strategies, and now we're discussing a new publication about developmental social pragmatic interventions, and this is a systematic review paper. So welcome, Amanda.
Hi, Daria. Thanks for having me.
You're welcome. Now, for listeners out there, I'm going to be posting a link to this new publication. It is an open access publication available. You can find it at affectautism.com. It will be under the Developmental Social Pragmatic if you do that search. And we're going to talk about what this all means. So, Amanda, I'm going to share my screen and show a link to the new publication, and tell us what exactly is this publication all about, and what is developmental social pragmatic?
Yeah, so I think we should probably start with explaining what do we mean by when we say a developmental social pragmatic intervention. So these interventions are kind of underlying on developmental psychology. So they integrate principles from developmental psychology where we follow a typical developmental trajectory, right? So we're going to target things like joint attention and engagement and reciprocal interactions before we start talking about targeting words or putting words together. So it follows a typical developmental trajectory. It also incorporates elements of transactional models of language development. So in this model, what you think about is that it's not just looking at the child in isolation, but really looking at if it's the parent and the child interacting, or if it's two children interacting, you're looking at the dyad or the interaction to see what are both parties doing to support and enhance the child's communication. And then the other model that DSP Interventions pulls from is the social pragmatic model of language intervention. So of language acquisition, sorry, not intervention. So in social pragmatic models, intervention focuses more on the child's intent, right? And why the child is communicating and how the child is using language in meaningful interactions. So it directs attention away from things like focusing on the grammar, right? Is the child using their plural S at the end of the word? Not that that's not important within social pragmatic models, but it's not the emphasis, right? So we're more interested in the child using meaningful language and reading the child's intent and thinking about why the child is communicating, and is the child able to use their language in lots of different contexts with different people for different purposes.
And so basically not just how language develops, but communication, because if a child is frustrated and can't let someone else know, they're going to be very stuck in certain behaviors or something, and we don't know why. And when they're able to communicate with us, whether it's non-verbally or through words, all of a sudden a whole world opens up for them.
Yeah, most definitely. So that's a really important point, is that we're not just looking at, although the social pragmatic model of language acquisition does look at language per se, it develops through these foundational capacities of a child communicating with gestures, with their facial expressions, with their body movements. So we look at the child using these in a very meaningful and appropriate way for their different interactions to fit their context before we start mapping the language onto it within DSP models as well.
So what exactly did you and Janice Oram-Carty aim to do when you started this publication? It is a systematic review paper.
Right. So that means that what we did was we kind of had a very explicit way of searching through all of the different publications that have been put out on different interventions for preschoolers with autism. And we searched through all of these different interventions. The first thing we wanted to do was really have a clear approach for identifying what interventions are DSP interventions. Because what we noticed was happening was that if an intervention said, hey, I'm a DSP intervention, in a lot of the reviews, it was just classified under a DSP intervention. Now, the problem with that is anybody can say, right, I'm a DSP intervention based on their understanding of what DSP is. And if the interventions that are all classified as DSP don't actually meet up on their theoretical kind of underpinnings and the way that the model is used, then we're not really comparing apples to apples here, right? So we want to be able to have a really good understanding of what DSP interventions entail, and are all the interventions that are claiming to be DSP really kind of meeting all of those different criteria. So that was our first step, was to develop a kind of a systematic way of identifying DSP interventions, finding all the different interventions that said that they were DSP, and finding all the different articles that had classified interventions as DSP in the past, and then going through and evaluating, do all these interventions meet the criteria to be considered DSP? So do they use a typical developmental trajectory, which aligns with developmental psychology? Do they use kind of parents and interaction, looking at the dyad, which aligns with that transactional model of language development? And are they using the social pragmatic elements that we mentioned that focus on kind of the meaning and functional language use, rather than focusing on the grammatical structures and the words specifically?
And are there any, I think I recall seeing that list. Now, you just listed a bunch of things, but I remember one thing that jumped out to me was naturalistic observations.
Yes.
Is that part of the criteria defining DSP?
Yeah, so table 1 of the publication outlines in a nice little chart, all of the criteria for which interventions qualify for DSP versus non-DSP. And along the side, you'll also see a list of the interventions that were either self-identified as being DSP, or previous publications had identified them as being DSP. So the fact that the intervention occurred within a natural setting is one of the criteria that is included in a DSP intervention. And if you look at the table, you'll notice that there are a great number of the interventions, some which actually didn't meet criteria for DSP, but they still met criteria for following that element of the intervention.
So in the final column on the right, this is where you conclude whether they're considered DSP or not.
Correct. Yes.
Okay, very interesting. So is there anything else you wanted to say about this table?
I think one of the important things to note is that so this criteria came from a publication that was previously written by Brooke Ingersoll. And there was one element that we did add to the criteria for a DSP intervention, and that was use of explicit or indirect prompts. Right? And the reason that we thought that this was so important to include within this model is because of the focus of DSP interventions is about reading children's intent and reading and having them use language in functional ways. It's really fundamentally different to have a child prompted to use kind of expected outcomes, right? So you think about those fill in the blank sentences, right? Dog goes. There's really only one right answer to that question, right? Or that fill in the blank sentence. Or also say please. Again, the child only really has one way of correctly answering that, that prompt, versus scaffolding to support the child's spontaneous generation, right? So if we have like, oh, look at the doggy, here's the doggy, right? And then you might even be like, woof, 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 and then see what the child does, right? They could respond by saying woof, woof back to you, or they could respond by saying, right? They might not like dogs, or they could respond by like pushing the dog away, or they could respond by petting the dog. So there's lots of different ways that the child could respond, and that would be more aligned with a DSP way of maybe approaching communication and language for the child. And so we wanted to include that in the criteria for DSP interventions, also because there's a push towards integrating behavioral models of intervention and developmental models, right? So I think more and more there's research to support that developmental models are super important, particularly with younger children when you're working with them, right? You need to work on those foundational capacities like attention and reciprocity, joint attention, engagement with a caregiver before you can work on language. And so if there's this push to combine developmental and behavioral interventions, that it's really important that we think about what pieces of the developmental interventions are we taking with us into these behavioral interventions, right? So if we're still using explicit prompts for language, it might align with developmental principles because you're still following a typical developmental trajectory. However, it wouldn't align with the social pragmatic model of intervention because there are explicit prompts and kind of only one right answer maybe for how the child responds to a question. So I think if we want to start looking at what are the elements of different interventions that really help to support children, then we have to be able to kind of dissect this a little bit further and think about what explicit prompting is doing for communication and language development, and is that what we want to be using to support their language, or do we want to use more indirect prompts?
And so let me remind the listeners that this review is about preschoolers.
Yes.
So it's about preschoolers, and that's when language and communication is developing. And then also that this publication is just from a communication standpoint. So this is not necessarily an overall approach or intervention for autism necessarily. It's specifically about from a communication standpoint that your focus is.
Right. I mean, we're not saying that explicit prompting is inherently bad, right? There's a time and a place. If you don't want your child to be running into the road, you're going to be telling them, stop, right? You have to stop. There's only one right answer to how you respond to this. But we're thinking about it from a communication standpoint. Is that the way that we want the child to be able to learn how to use their words flexibly in lots of different contexts, if they're reliant on somebody kind of giving them that prompt for how to communicate?
And so what, I guess, who's the target audience in your mind for this review? Is it speech and language pathologists specifically?
I mean, it's anybody who's working with a child on communication. Another audience, I mean, policymakers are really interested in systematic reviews as well. So it's a nice way to kind of summarize the research, kind of pull out all the findings, look for patterns among the different interventions, and also researchers, right? This is the type of work that helps to inform where the research needs to go next and what we need to be doing next. So it kind of runs the gamut. Maybe it's not as parent friendly. It doesn't necessarily tell you this is exactly what we think you need to be doing, but it does help to kind of inform what is the research currently saying right now, and where do we need to go next with the research.
And those were two things I was going to ask about. First of all, if a parent looks at this and looks at table 1, does that mean they should say, oh, okay, I'm not going to do any of the non-DSPs. I only want to do the DSPs. It makes my job easier because I can eliminate all of these other choices when my child gets a diagnosis and I'm confronted with all of these options. What the heck do I choose? Okay, let me go through and cross out all the non-DSP. That's not necessarily your goal here.
No. So the table 1, what it does is it helps us to make sure that when we're reviewing the intervention studies that we're kind of comparing apples to apples, right? And we're not kind of collapsing interventions that maybe don't target communication in the same way, and then comparing them in one kind of foul swoop and saying these interventions work or don't work, right? It's important, if we're looking at the efficacy of these interventions, we want to make sure that they're all targeting things in as similar a way as we can possibly have when comparing different interventions, because we do identify that things are done differently, right? And these interventions are all also very individualized to the child and parents that are being supported during their therapy.
Right. And, oh, go ahead.
So sorry. So I was going to say that all that this chart does is it helps parents to recognize if they've identified, you know what, I think developmental social pragmatic models are the way that I want to go. It would help a parent to identify which ones meet the criteria. And then you could look at the evidence that we've shared a little bit later in the paper with the results. And that's where we evaluate kind of the evidence for the different interventions, right? So you can look at DIR and DIR-based interventions and say, okay, what is the evidence for these interventions? Does the research show that this is really helpful for children, or does it show that more research needs to be done? So there's different interventions like CERTs. There's more than words, Haddon's more than words intervention. There's DIR-based interventions. So there's 3 different DIR-based interventions that are mentioned in this article. There's MERIT, which was based on the Milton and Ethel Harris Research Initiative treatment study that was done at York University. And there's the PLAY project, which is another intervention that is based on DIR. And then there was a DIR study as well that was actually done in Thailand. So we also talk about some of these factors and how they might impact the results, right? So if there was only a few children that were studied, the study might not be adequately powered to detect any sort of significant difference in the children. So we wouldn't necessarily expect to see really strong results with such few children in the study. Or the study that was done in Thailand, I mean, there's the resources that they have in Thailand to carry out the study aren't necessarily the same as what we would see in North America. So we might not expect to have the robust results that we see in the UK or in the United States or in Canada.
And let me just specify for the listeners, when she's talking about DIR approaches like the PLAY project, we're talking about the Developmental Individual Differences Relationship-Based Model, or DIR floor time, which Affect Autism is all about. And again, just a reminder that you can link to this publication at affectautism.com if you search Developmental Social Pragmatic or Amanda Binns. And I guess you had mentioned that one of the goals is to guide where the research should go next. And so what is your conclusion based on everything that you guys wrote up here of what needs to be done next in the research?
So what Janice and I found was that there was some compelling evidence to show that these DSP interventions really supported some of those foundational communication capacities, right? Not surprising, because we were looking at younger children in this review. So things like attention, the child's ability to socially reference and kind of look up to the caregiver's space, joint attention, initiation and reciprocity, all of those things were found to be really well supported in DSP interventions. But we didn't find consistent, I should say, positive findings for the child's language post-intervention. And there were a few things that were really interesting about that. So although all of these interventions are considered developmental social pragmatic, the tests that were used to evaluate the language, for the most part, were standardized language tests, which are typically more heavily weighted in assessing those things that I said that DSP interventions don't focus on, right? So they assess things like the grammar. Is the child adding their plural S at the end? Is the child talking about past or future? Looking at all of those different grammatical and vocabulary components of the
And you
child's
did
language.
say this is preschoolers. I can't imagine expecting a preschooler to have great grammar and knowledge of past, present, future. I mean, certainly some do, but to me, I mean, just from a layperson, I know nothing about speech language pathology other than the little bit from seeing my son's sessions, but I think
So,
to your point that that's not really what's being assessed. I think what's more important is the child's intrinsic motivation to communicate with another person and building these early foundational skills. So as a reader, I wouldn't be worried about the fact that there was not consistent findings in the language development per se, when I'm not really looking, I'm not as concerned with my son who's already 9.5 if he gets a grammar mistake, as long as he's communicating with me and initiating with me and has that joint attention, because he's intrinsically motivated to connect with me, and that's what the relationship brings out in him, is the desire to be with us in a shared world and communicate and all of that.
right. So, I mean, it sounds like your goals are very much aligned with kind of the philosophy of the social pragmatic model of intervention. And that's what I'm kind of getting at. So although the standardized tests are normed on kind of typically developing children of the same age, right? So we're not comparing kind of a 9-year-old speech to a child who's 4 or 5, right? So the expectations would be compared to the typical development of a 4-year-old, right? So we wouldn't be expecting the child to be using really complex sentences at that stage in typical development. So the child wouldn't be penalized on the standardized test either. But as you were mentioning, your goals are to have the child's kind of intrinsic motivation be able to be communicated and shared with somebody else. And that is captured, from my opinion, much better in things like language samples, right? So if you're looking at how does a child use language in their daily interactions that more closely model what happens at home or what happens at school, that's, for me, what I'm more interested in, right? Because that tells me that the child is going to be able to kind of generalize those skills a little bit better. So in the studies, there was a few studies that did use natural kind of language samples or natural videotaped interactions to evaluate the child's language post-intervention, and positive results were found when we used natural interaction outcome measures. So that's something that's really interesting, because the outcome measures should measure what we're trying to target in the intervention to begin with, right? So having outcome measures that align with what the intervention is actually focused on makes sense to me. So going forward, I would hope to see more of that be included in intervention outcomes. And another thing that I think was interesting is that they looked at kind of the mechanisms of change. So what were the things that parents were being coached on that seemed to really be impacting and connected to the child's positive outcomes. So two of the things were parent responsiveness. They were found to really kind of drive the change. So that says to me that as a clinician, that's something that I should focus my attention on in order to kind of help support the parents to learn how to kind of read those less, maybe those less noticeable intentions that the child is communicating, right? Sometimes the child doesn't necessarily overtly communicate something, like being able to point to the juice over there. Sometimes they might just kind of like look over at the juice, and being able to read that and respond to the child's intent seems to be something that really helps to drive change in the child's response to the treatment and positive outcomes. The other thing is synchronous behavior. So really kind of joining in with the child's interest, which aligns with DIR, with more than words, with CERTs, with PACT. That was something else that really helped to drive changes in the child's response to intervention. So I think it would be interesting to look at all of the different kind of core features of DSP interventions and look at which of those kind of strategies that DSP interventions include should we be thinking about if we're making kind of NDBI models of intervention and pulling from, we've already pulled from like the developmental psych and said, yes, you know what, behavior interventions need to follow a typical developmental trajectory as well. Should we also be thinking about pulling from the social pragmatic models of language acquisition? Maybe we should be pulling out the kind of responding to all forms of communication regardless of the goal. So that's one thing that DSP interventions do that really differentiated these natural developmental behavior interventions, the NDBI interventions, from DSP interventions. Was DSP interventions kind of, regardless of the goal, will respond to the child's intent. So is that something that maybe should be adopted if they're looking at kind of integrating developmental principles and behavioral principles? Also, the prompting, is that something? So if we can test kind of these mechanisms of the intervention and see which of them are driving the change in the child, then we better know how to individualize the intervention for the child.
Wonderful. And just again, a reminder to listeners that at affectautism.com under Developmental Social Pragmatic, if you search that, you'll see it'll be a video podcast up on YouTube or in the blog. You can link to this article, and this table 1 from the article we're showing right now, along the top, natural setting, child-initiated episodes, child-selected materials, yes or no, targets, general social communication, yes or no, adult responsiveness as a key strategy, yes or no, arrange the environment, yes or no, reinforce naturally, reinforce all attempts, or only indirect prompts. And that, whether it's yes or no, determines whether you categorize it as DSP or not. Now, Amanda, is it only if they all answer yes that they're DSP?
Correct, yeah.
Okay. So some of the interventions, and the interventions are listed on the side, including DIR floor time. There's some of them you've mentioned. There's Jasper, the Merit Study at York University, More Than Words from Hannon, PACT, Play Project, RDI, Responsive Teaching, Sunrise, SCERTs, the Denver Model, all of these, and there's others listed here, and then you can see whether it meets the criteria for this specific thing. And again, talking from a communication standpoint. So I think we'll wrap it up there. Amanda, thank you so much for sharing this with us. I hope that listeners will take advantage of the free open source access to the article and find it very useful when looking at communication strategies.
Thanks for having me and letting Janice and I share our article here.
Thank you.
Until next time, here's to affecting autism through play.